I think for every physician, there's a lot of challenges that we encounter, particularly during training and then after when you're encountering your own patients. And this is why it's very important to have very, very good training. So my name is Durand. I'm a plastic surgeon here in Miami, Florida. Let me tell you a little bit about myself. So I was born in Miami. I'm originally from Lima, Peru. The first big challenge was making the decision to leave Peru, where I grew up or where my family currently is, and making that decision to come to the US and really start my training. The moment that I realized I wanted to become a plastic surgeon was during one of my first mission trips. At that time, I was working with a plastic surgeon. He was US based and he was traveling all the way to Peru to do this work with an organization. And I really started out there as an interpreter. And I really had no idea who was gonna change my world and decide for me to do plastic surgery. And there was one specific patient that really got me thinking about this. And it was a little girl that they had picked up that morning from a river in Ayacucho. And someone had thrown him in the river. We assume it was a parent because she had a cleft lip and palate. So what the people would consider deformed. We basically took her in, we did the surgery, set her up for adoption. And then I was able to really hear her story afterwards. Years later, when I found out that she had moved on in life. The great part about plastic surgery is that you basically are trained to operate from head to toe. That's one of the things that sort of led me to this specialty. And the best part of training at a tertiary center, at a referral center from all over the world, which is Cleveland Clinic, was that I would see everything from the most basic case to the most complex. During my second year, I received a patient transfer from a regional hospital that had a gunshot wound to the face. And this was a young girl, under 20 years old, that tried to commit suicide. And she had basically blown up all the front part of her face in between her eyes, and she was severely deformed. We did multiple surgeries through the years, and really what culminated my time there in Cleveland was I was part of the team that performed her face transplant. And this was the second face transplant that I'd done. And it was the youngest one in the world. Surgery, and plastic surgery in particular, is not always predictable. There's things that don't go the way they're supposed to go. And there's things that you have to oversee and make sure this doesn't happen. So being able to plan cases and work with patients to achieve their goals, that's really what's important.